So what are movement disorders? These are neurological conditions that affect the motor control. Motor control means that I just want to touch the pen. I am using my brain to use my hand. So this is, I have control over this movement which I am doing, just holding the pen. But in patients with movement disorders, what they can have is either an increase in the movements, which is also called hyperkinetic movement disorders, or decrease in the movements, which is also termed as hypokinetic movement disorders. So there could be too much of movement when you try to hold the pen, or you try to hold the pen, it will be very slow, your hand will go very slowly and just hold the pen. Or sometimes in the same patient, in one part of the body, you can have too much of movement, and in the other part of the body, you can have very less movements. So the patient may be very slow in walking, but he may be having these abnormal movements in the other parts of the body. So these can exist together. The movement disorders can occur when a person is at rest. The classical example being a patient of Parkinson's disease, which I'll show you later. We have shaking of the hands at rest. It can be in specific postures, just holding the hands in front of the chest or holding the pen, and you can have tremulous or shaking movements of the hands. And it can be very specific. Some of the specific activities can cause movement disorders, just like while eating, buttoning or unbuttoning the clothes, just while typing or while writing, you can have abnormal movements of the hand, which is not there in other types of movements. So in several conditions, apart from these abnormal movements, there can also be many non-motor symptoms like problems of sleep. You can scream in the sleep, get out of the bed and start screaming or hitting the relatives. You can have decreased smell. There can be in certain type of movement disorders reduced memory. You can have what is known as behavioral problems, or sometimes what is known as psychosis or hallucinations, seeing something which is not there. And then the patient can have problems in controlling the bowel and bladder.